So Michael's asking, there seems to be a lot of talk about how bad Omicron is, but it depends on what channel you're watching. But they never mention the differences between Omicron and Delta and which is doing the most harm. Also, with all the people going to the hospital with Omicron, are they going because they're afraid of using extra caution, or is this an actual necessary visit? And that's from Michael there, Congressman Trone.
Mike, that's a great question, really good one. Earl Stoner of Washington County Health. Earl, you want to take a stab at that?
Oh, yeah, sorry, I was on mute.
No
the big difference between Delta and Omicron is really turning out to be really twofold, two significant things. Omicron is significantly more transmissible than Delta was, but I guess maybe a silver lining, if you could call it a silver lining, the preponderance of evidence at this point is pointing toward Omicron being a little less on the severity level. So really with Delta, what we were seeing was obviously a pretty highly contagious and transmissible variant that was causing pretty significant illness in individuals. But the vaccines that we have out were actually holding pretty good against it from a disease severity standpoint, and actually from a standpoint of just individuals becoming symptomatically infected. When we switched to Omicron, which at this point in time is about 95% of the new cases that we're seeing across the country, about 90% in the state of Maryland here. What we're seeing is a variant that has some escape ability from the vaccines and from natural immunity from like a prior infection. But again, we're seeing, at least at this point, preliminarily, we're seeing it a little bit more on the mild end. But I will caveat that with, just because it's on the mild end of severity doesn't mean that we're going to necessarily see less hospitalizations and less individuals in the healthcare system. Because when you factor in potentially, a quadruple, maybe even higher number of individuals that are becoming infected, just the sheer number of individuals that are going to need care out of that could possibly equal what we saw with Delta. So, again, two different variants, one with, not as transmissible, but with more severe outcomes, and then new Omicron, which, again, is the predominant, by far, variant that we're seeing now in new cases, highly transmissible. Think of a California wildfire, especially amongst unvaccinated individuals. And once it kicks off, you can just, see on the news now what that causes.
And I'd add that Mike is absolutely right. It does depend on what channel you watch. But I really, the channel that I watch is talking to folks like Earl, but also Meritus Health in Washington County, right there. They've got about 80% of their people that are in now in the hospital are unvaccinated. And the severe cases are just what Earl said, Delta, but they're at the breaking point with the number of cases. And I talked to 7 of my hospitals in the last 4 or 5 days, and virtually all of them are at the breaking point because of admissions, of which 80 to 85% are unvaccinated, unfortunately.